It's reasonable to say that some drugs only have early complications and some drugs are primarily late complications. And the more common early complications are things like rhythm disturbances, heart rhythm disturbances, Raynaud's syndrome, which people can get without cancer or cancer treatment. You can have acute heart failure that some drugs can cause.
With an anthracycline such as adriamycin, which is a commonly given drug, it's a vesicant and they can get problems that way, but really from a cardiac standpoint, it's a cumulative effect that can cause congestive heart failure.
You can have cardiac ischemia.
EKG changes.
Later, you expect to see more of the chronic problems that occur as the heart was damaged many years ago, and then it fails over time.
Long-term effect is where we really are going to see more of the cardiotoxicity components that I think of, not only with the chemotherapy and targeted therapies, but also radiation-induced cardiac toxicity.
Radiation to the chest, especially on the left side of the chest, if we can't properly shield the heart in order to get to the tumor, is also a risk.
If the heart is involved in the radiation field, that can occur months to even years down the road.
I've seen people that are many years after therapy and we didn't know that the electrical system in their heart was damaged and they're disease free, and they come in tired and it turns out they need a pacemaker. So I think that anything acute can become chronic, and anything later chronic in some patients can occur earlier.
Probably the easiest way to say what are the drugs that can cause cardiotoxicity, it's probably easier to say that almost every single chemotherapy, targeted therapy drug can cause cardiotoxicity. There are actually very few that don't. Fortunately, it's rare.
Early in the days of therapy, we didn't test for cardiac toxicity. And we're discovering that some drugs that were developed many years ago in the 1950s and 60s, we now have discovered are toxic, like 5-FU. And it has a very specific toxicity in that it can cause heart pain and it can cause rhythm disturbances. But probably if I were to really classify the drugs that are most likely, or the therapies most likely, I would say that we see it a lot with the anti-tumor antibiotics such as doxorubicin and daunorubicin and all of that family. We see it a lot with the newer oral drugs, the tyrosine kinase inhibitors. But if you look at the list of therapies, it would be probably something listed as rare in many other drugs.